Hi there, it's Didi, the Trini RD, soon to be RDN, yeah. And today is Wise Wednesday with Didi. So I'm gonna be talking about a stroke. Have you ever heard of a stroke? Have you ever witnessed someone having a stroke? Or have you had a stroke yourself? Let's find out what a stroke is first. There are actually different types of strokes, but it's to do with the brain. The first type is where clots can form in blood vessels of the brain and cause blockage. Clots can either form in the brain or it can come from other parts of the body and travel to the brain, where it actually blocks and prevents blood flow. So let's say this is your blood vessel and this is a blood clot. It can't pass. Nope. So it blocks it and there's no passage for blood flow. None. Blood clots can be because of plaque buildup, which is formed by too much fat in the blood and cholesterol. Another type of stroke is where blood vessels in the brain ruptures and bursts and it causes leakage into the brain. Blood leaks into the brain. So if this is your blood vessel and blood is flowing normally through, it ruptures and bursts and then blood goes out the other way, all around. Not very good visual, but whatever. Hope you get the point. So that type of rupture can be caused by high blood pressure. Persons who are at risk for stroke are persons who are elderly. So the older you are, both genders are at risk depending on your genetic makeup or your history, if it's family inherited genes, and those who have a very poor diet. So risk factors that we can control are obviously smoking, high blood pressure, diet, high cholesterol levels, excessive alcohol intake, and obesity. So according to the CDC, Centers of Disease Control, common signs that you should look out for if you know that you're at risk or other persons are at risk for stroke: a sudden numbness or weakness in the face, arm, legs, especially on one side of the body, sudden confusion and unawareness of where you are and what you're doing, trouble with speech. Didi, repeat after me. Difficulty seeing properly with both eyes, sudden dizziness, loss of balance, not knowing which way is up or down, and severe headaches. So if you see these signs and symptoms in persons, act fast. The quicker the signs and symptoms are recognized and the faster the treatment, the better the outcome. And the easy way to remember these signs and symptoms, think of FAST. Fast. F stands for face, asking the person to smile, seeing a face dropping at one side. Arms, asking the person to raise both arms and noticing if there's a drift or change in one arm, they can't hold it straight out. Speech, asking the person to say something or repeat what you are saying. Is it slurred or strange? And T for time. As soon as you get these signs, call the ambulance right away or get medical help. So according to the NHS, the best way to prevent yourself from getting a stroke is to exercise. Look at what you eat in your diet. Get your fruits. And your vegetables. Fancy day! Stop smoking and cutting back on that alcohol. And the last two things, no, forget that. All of them is what trainees really need to work on. Some trainees. With the diet, you want to aim for high fiber foods. That's why I always stress with fruits and vegetables and going towards whole grain foods. And whenever I use foods in the kitchen or ingredients and it's high fiber, I always mention that because dietary fiber helps you to reduce your risk of a lot of chronic diseases. Just a small change in your diet, small change. And balancing those meals, getting a lot of colors from all of the food groups, variety. And if you're hypertensive, you have to be aware of your salt intake / sodium intake. Remember, there is no such thing as a no salt or no sodium diet because every single ingredient that you use to prepare a meal already has salt or sodium in it. If you read the nutrition facts label of your items, you will see that. So I hope that you liked the informative video. Yeah. Don't forget to like, share, and comment down below. Tag all your friends. Invite all your friends to like my page. Check me out on all my social media links such as YouTube, Facebook, Instagram, Twitter. And don't forget to click that like button and share. Click it. Click it. And if you're interested in advertising or sponsorships with Didi, just make contact. If you'd like me to be host of events or appear in any of your videos, let me know. If you're aware of any openings in my field, let me know, because I need a job. Bye. Remember, eat healthy, stay healthy, be happy. I'm going to write letters to the Ministry of Education on Health. Ow. I'm trying to help you guys, but you gotta let me help you. Let me help you. Tea can't help. Control that blood pressure.